Hi everyone, my name is Matthew Rowley, and today I will be talking about alternative exercise for lower back pain. Starting first with prevalence of lower back pain. So, the National Institute of Health said in 2018 that lower back pain was among the top 10 diseases and injuries worldwide. I guess I shouldn't say lower back pain. Lower back pain and injury was among the top 10 diseases. This prevalence peaks between the ages of 35 and 55. So this is when we're seeing the most of these symptoms. Lower back pain is more significant in adults than it is in children. This is due to the natural aging process. Bone deterioration causes osteoporosis or is osteoporosis, and it's something that we see in the elderly community. So furthermore, in Western countries, about 60 to 80% of adults are likely to experience lower back pain. Another great statistic from the National Institute of Health says that approximately 75% of adults will experience back pain in their lifetime. So, this is a significant amount of people who are suffering from lower back pain, and we're not really seeing any great prevention methods for them. In our current sedentary society, low back pain is increasing in prevalence. This is due, so the younger and older generations are both experiencing these effects. And this is really important to note because we haven't seen this younger generation, our younger generations experiencing lower back pain as much as we have in our current society today. This is due to occupational posture, sedentary lifestyle, improper exercise, poor diet. All things that we hear about all the time in lifestyle medicine. Accidents and poor decisions are also a major factor for low back pain and injury, and we see this especially in the male and elderly community. Males are more accident prone than are females, and the elderly community is more accident prone than both of them. So through aging, osteoporosis makes the simplest tasks riskier. We're seeing that falling is happening more often. And with the falling, we're seeing lower lumbar fractures. We're seeing upper back injuries. It doesn't matter. But the older we get, the more we're seeing that prevention for these is very, very important. Prevention. So presently, the prevention of back pain is rarely discussed. We're not talking about it with our kids. In fact, if anything, we're showing our children that sitting for 8 hours a day is acceptable, and this just isn't true. So poor posture is indicative of these same behaviors. The more that we sit and slouch and have more poor posture, the more we are going to continue having those symptoms. As one of our top 10 diseases, learning how to effectively treat and prevent lower back pain and injury should be a very, very big priority, and it is not. So a little bit about our current treatment, and I wanted to go into a little personal anecdote here of my experience with lower back injury in the current medical system. Last summer, I fractured L1 doing some work in my garden. About 400 pounds of dirt fell on my pelvis and took me to the ground. And I was immediately rushed to the hospital, the ER, where we did a bunch of testing. The first time I met with the doctor, we met for about 5 minutes, and he did not think that I had broken my back, although I was pretty sure that I had. But after testing, we found out that I did fracture L1. We spent another 5 minutes talking, maybe, and he gave me some hydrocodone and a back brace and told me that I would have about a 4-month recovery period. He also put me in touch with a bone doctor, and we went over my bone density and how well everything was looking and operating normally, and everything checked out, which was really nice that he recommended that. However, I didn't get any options for treatment outside of the prescription medication and back brace that he gave me. The current treatment for back pain and injury mirrors this experience. Spare more severe back injury, which needs surgical procedure. So if it's a really, really, really severe back injury, they're obviously going to be rushed into surgery. But this is how our current treatment how we are currently treating back injury and pain, and it's just not appropriate, especially for how big of a majority this is affecting. Sometimes physical therapy and visiting a chiropractor are also suggested. I was not suggested these when I was visiting the doctor, nor the bone doctor. So we're seeing that if money is an obstacle, the Western practice is to use medication to numb the pain and try to stay away from activity that could cause more pain. And I strongly disagree. I think if anything, more exercise is required, maybe not, of course, immediately after a back injury, but if you're experiencing chronic lower back pain, staying off of exercise is not going to help that happen. Lifestyle medicine and traditional modes of healing are progressive. And we're seeing that in the Western society, more and more people are accepting these modalities as real, and they're taking them into actual consideration for practice. This makes treating low back pain and injury by traditional means all the more efficacious, so we can really dive in and help the people that want to be helped. Traditional holism looks at the whole person, mind, body, and soul. It takes into account all of life's stressors that individual is having. It works to promote health on an individual level, and the exercises are generally simple, light, and strengthening. Yoga for lower back pain and injury has shown some incredible results, and we're seeing a lot of pain relief happening from yoga. It is a proven efficacious option for treating lower back pain and injury. Focuses on stretching, posture, breathing, and movement to allay the aches and pains of the body. Great for strengthening and toning muscle and bone. And this is just, all of these things are directly correlated to how this can help with lower back pain. Yoga is a little bit different in the sense that yoga can be very rough on the body if that's the type of practice somebody is looking for, that really strengthening practice, or it can be very light, nice, gentle exercises for somebody who is maybe fresh off of a back injury or something like that. A study conducted in 2017 on 159 subjects tested the effects of Kundalini yoga for lower back pain. And I don't know where this second part of this went, but it showed incredible effects. This was one of the studies that almost everyone in the study said that they felt relief from the yoga. Another study researched 100 war veterans and provided them with professional yoga classes once a week for 12 weeks. They did follow-ups 1 month, after 1 month, 6 months, and 12 months. So they had some home training in here. They said that there was a significant reduction in lower back pain. The veterans are known for lack of resources, and especially in the VA isn't offering these kind of treatment options. And they found that practicing yoga at home significantly reduced back pain and the money necessary to relieve pain. And this is incredible because I think this is a problem that a lot of people are facing. And among the veterans, thank goodness, opiate use was significantly reduced. And this is something that I think we need to be pouring money into, is how can we get away from opiates? How can we get away from thinking that opiates are the only effective pain relieving medication? A meta-analysis of 6 studies focused on the pain and functionality outcomes of yoga to the treatment of lower back pain. Pain outcomes were measured on the same scale as the previous study and showed an 18-point drop on the 100-point scale. Functionality was measured using a 10-point disability scale and showed a nearly 3-point reduction in the inability to function. So these people were able to get up more, they're able to be more mobile. Both studies showed a significant decrease in pain after 12 to 24 weeks. And this is pretty common for all the studies I've been seeing, is in yoga, about 12 to 24 weeks is the norm. When we get into things like Qigong and Tai Chi, it becomes a little bit more, and we're seeing that happen in years as opposed to weeks. So Qigong for lower back pain. Qigong translates to subtle breath cultivated skillfully through practice. There's a lot of different translations for Qigong, and it's often called the mother of Tai Chi. And it is very much about balancing, harmonizing outside and inside energy. In a particular study, 2 men with historic chronic low back pain were interviewed on their successes of Qigong. I know that I've said this multiple times. One of them is incorrect. Qigong, it's one of them. It's the proper one. I'm in traditional Chinese medicine. I should know this, but I don't. So this study, and I wanted to focus on one individual from this study. So this was a 70-year-old who was just extremely passionate about Qigong's efficacy. So there were 2 people in this study. There were 2 separate case studies. One of them was Susan and one of them was James. Susan was about 51 and James was 70. But in James's story, he couldn't walk. So the man would fall down at very inopportune times. He would be at work and he was finding that at the peak of his symptoms of lower back pain, he was literally unable to stand for 5 minutes or more. He started practicing at home. He got about a 5-minute video, which he did every day until he was able to attend classes. And when he was interviewed about 5 years later, James says he owes his life to this practice, which is incredible, just amazing words. And not only has a spring in his step, but a spring in his heart. Says that Qigong saved his life and brought him closer to the world and his relationships. And this was after just 1 year of practicing Qigong, which is really incredible. So we're seeing, and like I said earlier, this is less of the case than most of the research I've been doing. So it's showing that about 3 to 5 years of Tai Chi or Qigong are actually the norm for what is going to provide the most efficacious treatment. In conclusion, while these are but 2 alternative exercises coherent with lifestyle medicine treatment for low back pain, there are many, many, many more. Walking practice, I did mention Tai Chi. There are some amazing traditional exercises and practices that can get us moving and can get us feeling better. Furthermore, utilizing these treatment options from a young age could show significant improvement in the prevention of lower back pain. The longer we wait to treat ourselves mindfully and with intention, the greater we limit our progress and potential to integrate medicine. And this is just overall, I think we need to be really from the ER saying, go take a yoga class, go try Tai Chi. Have you ever heard of Qigong? Productive change in lifestyle leads to ultimate success. And this is just to say that I think one of our largest problems as a society that we're facing is our inability to want to get up, to want to move around, to want to be active when we're feeling these pains, when we're feeling these ailments. But really the best thing that we can be doing is taking action, not only in these movements, not only in these exercises, but in our own health. So finding out about herbs, figuring out what we can do on a cheap and holistic level for ourselves is very, very important. And these are my references. Thank you for watching.